Good morning, Professor. Good morning, everyone. My name is Khushpreet, and my team members are.
Kirandeep Kaur.
Muskan Paul.
Rashmi Sharma.
And today we are going to explain the scenario which is given. The scenario is you recently begin a new role at a local hospital that involves training and development of hospital staff. Administration is planning on implementing a new EHR software set to launch in 6 months. Moving away from hard copy filling systems, and your job is to support the team by leading and preparing them for the future changes. So now there are some ways how we can implement a health electronic record. So first of all, we can assess the knowledge of the staff and conduct some assessment of the hospital staff by knowledge by conducting their current knowledge and skills related to EHR systems and as well as a computer knowledge. This can be done through some surveys, interviews, and workshops. And also understanding the staff's existing expertise will help us in the training program accordingly. Second one is create a training strategy. On the basis of the assessment, we can create a training strategy, and we can develop a detailed training strategy that cover different aspects of EHR software, in which we can include some features, data entry, retrieval, security protocols, and troubleshooting. These various learning styles and preferences of the staff when designing the training approach. Rest of the topic will discuss by the Kirandeep Kaur.
Good morning. My name is Kirandeep Kaur. I'm going to talk about the set clear objectives and training for the EHR. So firstly, we need to define the clear and measurable learning objectives for each section. Make sure the objectives align with the hospital's overall goals for implementing the new EHR software, as well as we need to organize the training section and workshop for all the staff member to understand about the EHR software. Use a combination of hand-on practice, demonstration, and interactive learning to engage the participants effectively. As well as we need to encourage the staff members for the questions and create a positive learning environment. And finally, we need to engage the campaigns and super users. We need to identify the individuals who show a keen interest in technology and are quick learners. Enlist them as EHR campaigns or super users. These individuals can provide additional support to their colleagues during the training and act as go-to resource after the software is implemented. Thanks. Now my section is complete. Now my group member Muskan will be going to explain about their section. Thank you.
Hi, my name is Muskan Paul. I'm going to explain about address concerns of staff members. So be prepared with that, helping the staff member understand the benefits of transitioning to new electronic health record software while anticipating the learning curve require thoughtful and proactive approaches. Here are some strategies I'm going to explain about the implementations. So we can provide training and education by offering comprehensive training programs to familiarize staff members with the new electronic health record software. We can develop a training schedule that may accommodate different learning styles and allow sufficient time to practice and hand-on experience. What they can share their views, whatever they have done in their past, and address the concern proactively with addressing the concerns and doubts of staff members, where staff members can voice their questions and receive transparent answers by which they helps them to improve the efficiency and improves the data accessibility, which further develop the chances of reducing the errors in medical departments and enhance the patient care also. And next is test those who know very little about the EHR. So staff members must know about effective communication skills and provide supportive environment so that staff members can share the benefits of new EHR software while navigating the new learning curve arise in electronic health record new system. Next, Rashmi Sharma will discuss further.
Good morning, everyone. I'm going to discuss about the rest of the topic. Uh, Firstly, I want to add some benefits which are going to helpful for the hospital staff. Like it can provide the hospital staff all the knowledge about the medical record of the patient. Either they are in the OPD or in the wards, they can access the data of the patient anywhere from the hospital. Then if this system is implemented, this will be helpful for the hospital staff. That's why this is required to add in the hospital. And there are some strategies like post implementation support and resources and continuous implementation which can help to implement the electronic health resources effectively in the hospital records. Firstly, in the post implementation support, we can offer refresher training to the hospital staff. Sometimes some of the hospital staff have almost already knowledge about the EHR system because they have previous experiences or have known to that system in their study period, so that they can be improved. And the staff who has no knowledge about the EHR, they can given training on that. Moreover, they can be provided with the documentation sources, like they can be given the guided material and user guides, user manuals which are published by the provider who is providing the EHR material to the hospital. And mostly this is a user manual easily accessible to the hospital staff. In the continuous improvement, we can track the record of the hospital, and as a staff is making the record, and they can be do it by easy manner, by adding this slowly in the hospital record. And it is helpful for the whole staff and whole hospital because it will help to improve the quality care of the patients. That's all about our topic. And if you have any queries, we have given our number on the infographic. You can call us anytime as you want. Thank you.